gynecologist, a fertility expert, and an obstetrician. Obstetrician. Did I say it right?
Tongue twister.
Hiyo imekuwa tongue twister. Daktari, karibu sana.
Asante sana.
Yes. Daktari, let's dive right into it.
Let's go for it.
Yes. Karibu sana. First, a quick introduction. My name is Kireki Omanwa.
Kireki Omanwa.
This brother over here is Emmanuel Kisiangani.
Emmanuel.
We have a lovely lady who sits with us, but ameshikwa na homa kidogo. Sasa tumemexcuse apumzike. Together with the fourth tier called the msikilizaji, we make the adults in the room.
Absolutely.
So what we try to do every day is to have very, very authentic conversations about lifestyle, money, sex, and even infertility.
Why
but
not?
we are very excited today that you would honor us with your time.
No problem.
So feel at home, Daktari.
Asante sana.
Asante. So let's dive right into it. What does fertility mean? And when would a couple be considered infertile?
First of all, thank you very much for welcoming me to this this edition.
Yeah,
the honor it's always good to come and share our thoughts, share our experiences. And of course, as you said, the fourth tier is very important.
Yes.
Because all of us are consumers of this information. As you rightly say, that tongue twister, obstetrician.
Obstetrician. Ilinipotea na nakuaga sawa na ngeli. Sijui imeenda wapi leo.
Obstetrician and gynecologist. My name is Kireki Omanwa.
Yes.
I'm a consultant obstetrician and gynecologist and a fertility specialist. I teach at the University of Nairobi. And obviously, I help couples who have issues with infertility.
Oh, wonderful.
Now, you started very well by saying infertility is when a couple trying to have a baby, even have frequent sex, and a year has passed and they don't have that pregnancy. According to World Health Organization, actually infertility, can be split into two.
Yes.
There is primary infertility and there is secondary infertility. So with the primary infertility, you have a couple, they don't have to necessarily be married, but are in a relationship and have frequent sex, where frequent sex is 2 to 3 times a week. They are not using any contraception, and 1 year has passed, and there is no pregnancy. So that is primary infertility.
Yes.
Now, secondary infertility, you have this couple, once again, also have regular intercourse 2 to 3 times a week, no contraception, and here there is a rider that the lady is not breastfeeding, because breastfeeding can actually work as contraception.
All right.
But the difference between secondary and primary, in the secondary, this couple have had a pregnancy before, they have had a child, and now, or children for that matter, and they are now trying to have another child or other children.
Yes.
And it is not happening. Again, in that period of 1 year, with another small rider, when we cross 35 years for ladies, now that period, that 1 year period is actually shortened to about 6 months. Wow. So if they've tried for 6 months, you are 30, you are 40, for instance, and you're trying to have your first baby, we don't wait for a whole year because time is not on your side.
Oh,
absolutely.
Goodness, that's very interesting. So if you're a lady above 35 or 35, then your time is shortened to 6 months.
Absolutely, your time is shortened.
Very, very interesting.
Yes.
So within the 6 months, explain what you mean by it's shortened to 6 months.
Why it is shortened?
Yes.
Why it is because we'll talk about the causes, and I'll actually talk about that in a minute when we start talking about the causes of infertility in women.
Okay.
Now, maybe just to give the listeners just a rough idea about the extent of this problem.
Yes.
Research has shown that about 15%, approximately, and these are conservative estimates, about 15% of Kenyans have a problem with infertility. If I ask you whether you know of anybody who has infertility, you say, yeah, I do know. Anywhere I go, when I teach, I ask the students whether they know of anybody who has issues in infertility or have heard of somebody who has infertility, and usually it is the whole class which does that.
Yes.
So, according to the last census, we are 48 million, approximately. So if we say 10% of 48 million is 4.8 million.
Yes.
We add 5% to make it 15, though half of that 4.8 is 2.4.
Yes.
So when you add 4.8 plus 2.4, you have about 7.2 million Kenyans. Conservative estimate. Some researchers say that actually infertility in this part of the world can actually go to 20, even 30% of the population, which again is a paradox because we have the highest numbers of children in this part of the world. In Kenya today, an average family is about 4 children, average statistically. In Europe is 1, maybe 2, 1 point something in other countries in other European countries. So here we have the highest number of children being born, but then we also have the highest number of cases of infertility. Now, just to put it in perspective, tuna coronavirus inaendelea sasa hivi.
Yes.
We saw Italy has been locked down.
Yes.
The whole of Milan is locked down.
Yes.
So if we were to take the numbers, 7.2, Nairobi has about 4 million, let's say 4 million.
Yes.
So we'd have to throw in a few other counties. We throw in Kiambu, we throw in Machakos, we throw in Kajiado, we throw in Narok as well. And who knows, maybe a bit of Nakuru. We lock it kabisa.
Yes.
We say all these people are suffering from infertility. It's a big
huge number.
It's a huge number. And we are suffering in silence.
Yes. In fact, I wanted to ask you if, it's hush-hush. Most people wouldn't even share if they know someone. Do the students share openly? Or it's normally people don't really share, hey, that one is infertile, that one is infertile.
They don't.
It's hush-hush.
They don't. It's a quiet thing, I'm suffering alone, I don't want to discuss, and so on. Sometimes you may get colleagues, your friends, you've been trying to have a baby with your family, with your wife or your girlfriend, and then a year has passed, 2 years have passed, and people are asking, what is happening. Some of your friends can ask you in jest, hey, Emmanuel bwana, sasa haya mambo mbona uwezi, unataka tukusaidie tukuonyeshe, It can be in jest, but then it is very painful.
It is.
And then you go home and think, what kind of man am I if I cannot even, impregnate my wife? Something which seems to be very straightforward, but it is not that straightforward.
Dr. I was reading from different readings, some very intentional, some random. I've read that taking a hot bath for a man can lead to infertility.
Yes.
Wearing very tight underwears can lead to infertility.
Yes.
Exposing male organs to heat from, say, the computer or you are driving for too long.
Yes.
Are these true or are they just myths?
As a number of them are myths, a number of them are true.
Yes.
But before we go to the myths and what is true and what is not true, maybe let's look at what are the reasons, the causes of infertility.
Yes.
Because we are told ladies first, tuanze na ladies.
Tuanze na ladies.
Tuanze
Juu hata
na
tuko wanaume hapa,
Sindio?
wacha tuanze na Okay, that's true.
We start with the ladies.
Yes.
Now, remember I mentioned age, 35.
Yes.
Age is a big problem. It's in the UK where I used to work, we saw a lot of women who had issues with infertility because of age. Why do we talk about age? Women are born with a set number of eggs that they are going to use throughout their reproduction period. Now, when a lady has her period, what basically happens is that an egg has been prepared to be fertilized, but that egg has not been fertilized. So the womb, which is ready to receive this fertilized egg, actually sheds off the lining. Now, in order for us or for the ladies to get to that one egg, which is ready, they lose about 700 eggs every month. Wow. So if you start with a number X and you lose X minus 700 every month, and usually ladies start their periods around 13, 14 years, and then you get to 35, so it means you've been having periods for 22 or 23 years, every month losing 700 eggs. So that store that you started off with is actually depleted quite seriously. The opposite for men. Men, we don't have that issue.
Yes.
Men, we produce actually a fresh, let's say, call it a fresh supply every 2.5 to 3 months. So that is why you may find a man who is, let's say, in the 60s or even in the 70s, in some societies, they get a young lady, and if the man is up to it, he can actually impregnate that young lady, and they get a baby. So age is a problem in ladies. It will it also does become a problem in men, but a little bit later on, but because of other reasons, but not because of production of sperm, because of erectile dysfunction, for instance, and so on. Now, the other problem which we have as a reason of infertility in this part of the world is blocked tubes. If you remember a little bit about the fourth form biology, in that women have tubes, fallopian tubes.
Yes.
And these fallopian tubes is where the egg passes through and the sperm swims through in order to get to the egg. Now, if these tubes are blocked for whatever reason, the biggest problem that I have observed for blocked tubes in this part of the world is sexually transmitted diseases. And why is that so? You may find that this lady is a zero grazer, tuseme zero grazer, but the man plays away matches, international matches, and so on. Alafu na home matches pia anacheza. So whatever he collects from out there, all the trophies, anamletea huyu. So the lady gets infected, and one of the biggest problems actually called chlamydia is a silent killer in that it affects and it blocks the tubes, usually without any symptoms or even any signs. So blocked tube is a big problem.
So there's nothing to show that you have the chlamydia except for maybe being tested?
Exactly. That's the whole. That is the biggest problem. It's sexually transmitted. It is almost without any signs and symptoms. We will know that actually there is a problem when we take this patient to theater. We put a camera inside the abdomen, and then we look, and then we find some what we call flimsy, nice in quotes, nice adhesions. The tubes are all blocked, and these adhesions are all over the abdomen. A very typical sign of chlamydia infection.
Dr. Thank you so much, man. This conversation is just getting started. This is 94.4 SpiceFM, where we have authentic conversations. Eric, what are we talking about today, my brother?
We are discussing ways to understand better about infertility in men and women.
Yes,
and we have Dr. until 10 o'clock.
Yes, so please tell a friend, because I feel like this conversation, we should share it with as many people as we can. So I'm Jeffrey Osborne coming back, and then we'll be back before you can say Rumpelstiltskin. To 19 minutes past 8 o'clock. We are the adults in the room, and this is 94.4 Spice FM. Sugar and spice, everything nice, man. And everything is nice right here on this station, man. Jeffrey Osborne still touring in the United States of America, man. He was one of those hit makers. Now 70 years old, but still touring, man.
Strong,
still
man.
Strong and doing his thing. And, the playlist is fire, man. We have some more hits coming up. We have some Lionel Richie, who's gonna come up, as we go along. Yeah, like this show is fire. Conversation, nice music. Conversation, nice music. Like this is a combination.
What a one! You got it right, my brother. Very good evening to you if you're just joining us. I know some of you are leaving the office, and they're like, "Hey, watch and excuse the spice." Thank you. You've made the right choice. And today we are discussing ways to better understand infertility in men and women. We'll cover everything from the myths, causes, facts, and also just ideas about accepting childlessness after infertility. And because we are not experts in this field, we invited a very wonderful doctor. His name is Dr. Kireki Omanwa, a gynecologist, a fertility expert, and I'll get it right this time, obstetrician.
Absolutely.
Yes, so you are in for a wonderful treat. And remember also that Spice FM is a family, and you're a big part of this family. That means you can share your thoughts on the feedback about the conversation we are having today. We always advise, if you're on Twitter, to remember the hashtag AdultsKE so we can better and quickly locate your tweet. We are also on Facebook and Instagram, and our handle remains as always at SpiceFMKE. Daktari, there's a lot of traction on Twitter already. A gentleman called Rafael Korir said, Daktari, I've been trying to sire baby number 3 for some time now without success. So the problem is, is the problem that my wife periods are somehow irregular? How can I be helped? I think tutamwongelesha baadaye. There's a gentleman here called Philip who says, I am Philip, I'm tuned in with a pen and a paper. There's Jane, there's Nessie. Watu wako daktari nakwambia wamekaa kando ya moto
nakwambia Eric, hata kuna jamaa anaitwa David who also says interesting topic, but please ask him about losing interest in sex and not performing well, as in weak and not lasting long to satisfy a lady. The feedback is already streaming in.
Very
but
well.
going to get there. And Daktari, you were talking about some of the causes of, this infertility. And you talked about chlamydia being one of them in ladies. And you talked about zero grazing men. Tuanzie hapo. Yes.
Sasa, now, with the zero grazing and playing away matches and so on, we have, unfortunately, very high chance. It's called high risk, basically.
Yes.
Very high chances of collecting, all manner of things and actually bringing it to your spouse. It can also be the other way, that the man is zero grazing, but the partner is also doing all manner of things and collecting all manner of things. Now, with the blocked tubes that we started with, it can also happen in men. Men also have tubes. Those can also be blocked, but we'll come to the men in a few minutes.
Yes.
Now, the other reason of infertility in women in this part of the world is what we call fibroids. Fibroid is basically a growth, a thickening of a part of the womb. 40 to 60% of women of African origin will have fibroids in their reproductive period. Oh, wow. The issue is not so much as the fibroid, but the location of the fibroid. Now, if we can imagine the womb as this studio, the outside bit is what we call the myometrium. That is the muscle of the womb. Here where we are is what we call the endometrium. So when an embryo implants and an embryo is fertilized egg, this inside here, that is where it would implant. Right. So if we have a fibroid inside the endometrium, that will be a big reason for infertility. Now, if you have fibroids outside the endometrium, the size will be important. So if you have an you have a fibroid which is, let's say, 6 centimeters, 7 centimeters, sometimes you have even 12 centimeters. Sometimes you have many of them. You may have 50. 3 weeks ago, 4 weeks ago, I removed 75 fibroids from a lady who had also been trying to have to get pregnant. Now, the irony was that her friends would see her and say, "When are we coming for the baby shower?" Oh, wow. And she's trying to get pregnant because there were many. The womb is big, so everybody assumes that she's pregnant. So when we did a scan, we find there are quite a number of fibroids. I wish I could be able to show you so that you can see how they looked like. So when I took her to theater, I got 75 fibroids from them. No, they look like potatoes, different sizes, from around 1 centimeter to about 7-8 centimeters. Now, this will stop a lady from getting pregnant. Why? Because when there are many like that, or if you have a big one, it can lead to blockage of the tube, for instance. It will not allow the sperms to swim to where they are supposed to swim. They will produce some chemicals which will actually deter the sperm from getting to where it is, and so on and so forth. So about 40 to 60% of women of African origin, it doesn't matter whether they are Kenyan or they are Ugandan or they are African American, whatever it is, have issues with fibroids.
It does issues with fibroids also emanate. Is age a factor about fibroids?
Yes, because they're usually during the reproductive period, which is from around 15 years to around 49 years. Right. Now, after that, because the ladies are not producing what we call estrogen, the hormone that actually makes them feel, behave, and be women, because we at that period we've started what we call pre-climacterium, or the climacterium has started. So the fibroids which are there, usually they reduce in size. So fibroids. The other thing that we have a problem with is irregular periods. That gentleman said they're trying to have a baby number 3, but the wife's periods are irregular and so on. The periods can be irregular because of different reasons. It can be because of the hormones which regulate the cycle. It can be because of what we call polycystic ovaries. It can be because of other chronic diseases, and so on and so forth. So to answer that gentleman, before we proceed, I think his wife needs to be checked. We look at her systems, we look at her hormones, and then we can see where the problem is. Regulate the periods, and then they can try. Because with the irregular periods, it's going to be very difficult, because the general understanding is that if you have a regular period, 28-day cycle, ovulation occurs around day 9 to day 12. So If they are irregular, you don't know when ovulation is going to occur. So you can have all the sex you want, but if you don't get into that window, it will be that, tumejaribu, tunafanya mapenzi, but it is not happening. So irregular periods. There's a big problem called polycystic ovaries. This affects about 15% of young women who are trying to get pregnant. Now, with polycystic ovaries, it's a syndrome. When you talk about a syndrome, is that some women will have some of the symptoms. Not all women will have all the symptoms. Some of the symptoms are very irregular periods. I had a patient who had a period every 3 years. That one is going to be a nightmare for her to try to get pregnant. They have issues with low libido. Don't feel like having intercourse. Quite a number of them are overweight, so they have a high BMI. Some of them have hair. Sometimes, probably we have seen ladies who have a beard, who have a mustache, and they are quite hairy as well, and so on and so forth. Some of them have issues with what we call insulin insensitivity. What is insulin insensitivity? Our cells, every cell uses glucose in order for it to function. When we have insulin insensitivity, it means these cells do not utilize glucose the way it is supposed to be utilized. And then you find there is a spillover of the glucose into the system, and this actually affects so many other functions as well. Now, in these patients who have polycystic ovarian syndrome, they have a little bit elevated amount of male hormones. Women have male hormones, a small amount, just like men also have female hormones, only a small amount. Now, in the cases of these women, polycystic ovaries, you find what you call androgens are slightly elevated because their systems are different. Their body is structured differently. Their skin is oversensitive to this hormone. So you will find that if it's slightly elevated and the sensitivity of the skin pores, that is why you find these women start having hair in places which are typically for men. You have a beard, you have a mustache, around the nipples there'll be hair, around the chest, and so on and so forth. These women usually have a lot of problems trying to get pregnant, in as much as they have what you call the ovarian reserve. The number of eggs is very high. Usually the eggs are of poor quality because of the bad chemistry which is going on in the ovaries. We have another issue called endometriosis. Actually, we'll be having a symposium in a few weeks about endometriosis. You remember we talked about this studio being the lining of the womb. So every month, if there is no implantation, there is no pregnancy, this lining comes out as a period. Now, in some women, this lining, a bit of this lining, which will be active, will find itself somewhere else. It will find itself on the ovaries, for instance, on the tube. Sometimes it can be on the cervix. It can be even in the intestines. Very, very rarely can it go to the lungs. Very, very rarely. A colleague of mine had a case whereby it went into the ears. How it went there, we don't know. So this problem is a big problem in that that bit of endometrium of the lining will behave just like the normal lining in the womb. The only thing is that it will disrupt the normal function of the reproductive system. If they are big, for instance, if this bit of endometrium outside there, what grows into what we call a cyst, which carries old blood, what we call a chocolate cyst, it actually can destroy the ovaries, it can destroy the tubes, it can destroy other organs as well. These women, some of them have very painful, not some of them, most of them have very painful periods. They have issues with having intercourse. Intercourse is very painful. Sometimes even going to the toilet is a problem. They have issues with passing urine. They have issues with opening their bowels, and so on and so forth. This affects about 5 to 10% of the young women who are trying to get pregnant. Now, there also is a problem with chronic diseases like diabetes, like hypertension, and so on. We have a problem with lifestyle. The way we eat, the way we operate, the way we drink. These days we notice our sisters are drinking just like men, or even worse. I had a patient who came to see me, and during my history taking, I usually ask, when it comes to what we call the social history, whether she works. She says yes, she works. Whether she smokes, no, she doesn't smoke. Whether she drinks, she said yes, she drinks. And then I asked her, what do you drink? You drink wine or you drink? He said, I drink a bottle. And then I asked, a bottle of what? She said, a bottle of Johnny Walker. And then I said, over what period? And she said, every Saturday night. So 1 liter of Johnny Walker every Saturday night. A horribly huge amount of alcohol. This will affect the normal functioning. Even if she was not trying to get pregnant, it's going to affect all other functions. So, well, my advice was, please reduce drastically that amount of alcohol, or better still, just stop, because it's going to be a huge hindrance in your trying to get pregnant.
Would you advise maybe less alcohol over, the people who drink every day, maybe after work they go grab 2 drinks?
Yes.
Is that better?
Now, when you talk about the amount of alcohol that is drunk, if we look at some countries which have what we call guidelines, like for instance in the UK, they tell you, drinking maybe 1 glass of wine a day does not have a problem. But the problem is that after some time there is tolerance. So that 1 glass may be not enough, so you can actually unaongeza kidogo. Alafu baadaye unaongeza tena kidogo. See, that is where the problem can be.
Doctor, I have a question.
Yes.
If she were drinking, say, a crate of beer,
yes,
would it also be as bad as that brandy or whiskey, whatever she was taking?
Now, that comes again to those myths that drinking alcohol, does it affect infertility and so on and so forth? What it actually affects is the function. If you drink 1 beer, I don't drink. I don't know how somebody feels when he or she is drunk. You drink 1 beer, it will not affect you much. If you drink several beers, you'll be boisterous and you'll be relaxed and so on and so forth. But when you drink that 1 crate, let's say 1 crate of beer, you'll be making so much noise. You are the sexiest person in the world, and when it comes to function, hakuna kitu utafanya. That is where the problem is.
Right.
So it affects your function, not necessarily the production of sperm. But cigarette smoking or marijuana, bangi, that definitely does affect infertility or fertility for that in men. I'll come to that in a minute. The other thing is the diet. We talked about lifestyle.
Yes.
The way we eat, for instance, has changed completely from when our parents, our great grandparents were used to eat. They used to eat, number 1, organic foods. You've grown your own, ngwashes, your own,
manago.
Everything is fresh from the farm. And then you would eat and then go and work. We would walk long distances, and we do manual labor. Now it's the other way around. In the morning, if I ask you what you ate in the morning, maybe a slice of bread, a slice of toast, maybe, and a cup of tea, because you are running to beat the traffic on Mombasa Road.
Yes.
Lunch, you'll eat something small. In the evening, wakati umemaliza kazi, now you want to go and relax, is when mama nakupikia ugali kabisa na ile nyama na sukuma, is when you really sort it out. And then you do what? You go and sleep. Now, if we do that over a period of time, you start having a public opinion.
Yes.
Meaning your wife is taking good care of you.
Tumbo inaanza.
Now you can see you are a married man.
Yes.
Now, the same with the woman as well. Anaanza kula vizuri. Well, Africans we like our women to be well endowed. Sawa sawa. Now, just imagine this. We're on a public opinion. And your wife has, love handles. So imagine it's like having intercourse with 2 pillows in front of you. Mzee afiki mahali anataka, mama naye apati ile anataka. So everybody is frustrated. Unasema hata hii kazi wacha ikae.
Tulale.
Tulale. Yes. So that actually becomes a problem, because it is you're trying to have a baby, and biologically, physiologically, you have to have intercourse to have a baby. Unless there is a problem, that is when now I come in as a fertility specialist and say, look, if there's a problem here, then you don't have to necessarily have this baby through intercourse. We can do other things in the lab. So these are some of the reasons in when it comes to females. Now, something else which actually is also a problem, but we don't think about it much, is stress. Stress is also a factor. Why do we say stress is a factor? Because we have seen ladies, we have seen couples who have tried to have children and it has not worked. They have gone and they have adopted a child or children. And then psychologically, we are okay. And then what happens? She gets pregnant. And then she gets pregnant again. So it's very difficult for us to quantify how much stress is needed for a lady to be infertile. So stress is also a factor that we know, and it is well accepted that it can lead to infertility. Ile stress kina mama wanapata from their family, immediate family, from their friends. You know, I had a colleague of mine who had been trying to get pregnant. She got pregnant, but she lost her pregnancy at 8 weeks, unfortunately. And you'd find her colleagues from church, her friends, calling to find out, umeanza kutapika. Hii tumbo mbona inakaa hivi, you know, that sort of thing, creating more stress. Yes. They don't know what these women are going through, or even these men for that matter. That insensitivity. I mean, you are not a man until you have had a child. You are not a woman until you are called Mama so and so, Mama Sophia, Mama Johnny, sijui nani. So if you haven't reached there, then you are not a man. Or you're not a woman. There are some places where you go, if you are not you don't have a child, even if you are mature, you are still treated as a boy. There's a gentleman who came and said, Daktari, this, I can't take it any longer. Whenever we go for family meetings, they say, now let the men speak. When I try to speak, they say, it's the men who are speaking.
Enda ukae
kwa vijana. So you are not a man. So these are some of the cultural problems which infertile couples go through.
Daktari, before you move on,
yes,
because I know we're about to enter the men sector. Looking forward to that one. What are some of the treatments? Ama hiyo tutaingia huko mbele.
Hiyo tutaingia tu
huko mbele.
Hiyo tutaingia huko mbele.
So ni relax.
We relax.
All right. And Daktari, you've said something. There's a friend of mine I was telling you during the break, who was like he hasn't gotten a child yet. You remember?
Yes.
And then mama yake paka akaenda ushago akamtafutia herbs.
Yes.
Akasema enda upeleke bibi yako akunywe hii every day for 14 days.
Yes.
So it's actually a real problem because she did that unsolicited.
Yes.
And she just came with herbs from the village and akampatia akamwambia, and she called to follow up and says, hey, umekunywa?
You see, the beauty about ladies is that they will look for help anywhere and everywhere. And whoever sends them help, they will actually adhere to it, even if this help is actually unproven. So we don't know, number one, what herbs they were. Number two, what quantities you were supposed to. Kunywa kikombe kimoja. Now, which kikombe? Is it this kikombe you have put, water for me? Is it that other, the coffee cup?
Yes.
Is it a glass? It is not quantifying.
Yes.
And then the other thing is that we don't know actually what is in those herbs and what quantity. Even though there are some people, I have nothing against, against herbal medicine. The only thing is that we don't know what is the active ingredient, how much of it is there, what are the effects, what are the side effects. Hiyo hatujui. Tunasemaga tu hii miti inasaidia kwa tumbo. Yes. Ukichukua matawi ya huu mti, alafu uchemshe, alafu unywe, itasaidia, itafungua, itaosha tumbo, utapata mimba. Which is not proven. So I think that we need to sort of either go deeper into the study of these herbal medicines, such that we know what works for what the active ingredients are, because that can be done. And then what quantities are actually active, what are the possible side effects, and so on and so forth. Then we can actually say, if you take this, like mukombero, for instance, our colleagues, our brothers from Western province, they say mukombero is ukitumia nguvu za kiume zinarudi. Now, we don't know how much of that mukombero you need to take. Ni kijiti kimoja ama ni vijiti 10, we don't know. So we need to sort of distill this knowledge such that it can be applied, uniformly across the board, as it were.
Alrighty, the hashtag is AdultKE, and we are here with Dr. all the way till 10 o'clock. This is that's the goodness of having this conversations, Eric, here on SpiceFM. We have Dr. for a long time. Okay, it's short, but it's long.
No, it is. It's very exciting. I am personally learning. That's why I'm keeping very quiet. Dr. I think before we go on a break, I would want to know if I'm a young lady, or we'll come back to men later. But if I'm a young lady, maybe 22 to 26, because you see on Nairobi, on Fridays, bars are super full.
Yes.
What your advice would be to a very young girl who goes out every Friday and dances, and maybe at the back of her mind, she's thinking, I'm not ready for those kids' business. I'll stop drinking at 30. Yes. When I start to be ready to start a family. I just wanted to know, would that intake of alcohol now affect her in the future? Ama anaendelea tu kulima hizo mapombe?
You can't say cause effect. Kwamba akikunywa pombe sasa, it will affect in the future. There are other things which will come with that alcohol intake, because we know that there's a possibility ya kuwekea mchele. Kwa mfano, number one. Number two, once we get inebriated, we lose our sense of control. Yes. So the possibility of, having sometimes unsolicited intercourse, and sometimes with people you don't know, and sometimes, different partners whom you don't know where they come from, and so on and so forth. So I think that is more of the danger than now that if I drink, maybe I go to the club and, take a beer or 2 or 3, whatever it is, enjoy myself, and then, I'm taken home by somebody, and we don't know what happens. And then there's another thing also, another phenomena of this one of drinking until you don't know who you are, where you are. You even don't know how you arrived home, and so on. So I think these are more of the problem, because they will later on lead to issues which actually are secondary to the drinking itself.
And Dr. what's happening right now with because I have many young friends, there's a lot of smoking of weed, which has become a very popular thing, in this time and age. Eric, remember I was telling you, most of my young friends seem to be very keen on the weed.
Wanavuta
bangi. 94.4 Spice FM. We are the adults in the room. Some Lionel Richie coming up. Eric, what are we talking about, my good sir?
We are talking about understanding infertility in men and women, all the myths and the causes, with Dr. Kireki all the way to 10 o'clock.
Yes, and we'll be back for more. He's going to tell us more about the men. So men, get out your notebooks. I'm sure you're writing notes about the ladies, but now we're going to move forward with this conversation. Lionel Richie, right now. It is 11 minutes to 9 o'clock. We are the adults in the room, the home of authentic conversation. We just want to thank you so much for joining us wherever you are. Today we're talking about understanding infertility in men and women. And we have a special guest, Dr. Kireki Omanwa. And we're having a good time right here in the studio. I'm learning so much, man. I wish I heard some of this information long time ago. But I guess, now is better than never.
No,
Dr. Thank you so much for coming through and making the time.
Thank you. You're welcome, Tabisa.
Eric, what wanasema?
Yes, if you're joining us right now, as you know, some of you came at the right time. We are talking about understanding infidelity in men and oh my goodness. Eric Leo alilala malimbaya. Yes, we were talking about infidelity earlier. So understanding infertility in men and women. And we are so delighted to have Dr. Kireki, who is a gynecologist and an expert in fertility expert, you would say. Not you would say, he is a fertility expert. And remember, you can share in your thoughts on Twitter, Facebook, and Instagram, as I see some of you already are. There's a lady here called Anne Jeb Korir, who said the process of accepting infertility is similar to the process of loss of a loved one. When anyone with infertility issues, kindly know what to and what not to say to them. I think she's talking about being empathetic.
Yes.
And also being sympathetic.
Sympathetic.
Yeah, you shouldn't be just blurting out weird things like Daktari was saying earlier. Sally says she's enjoying the conversation and she's learning a lot from our doctor. Thank you so much, Sally. Sally's listening from Nakuru. And then Boniface Kinaro says, very, very informative program. I'm following with a lot of keenness. So thank you very, very much. Remember, you can share your questions from 9 o'clock all the way to 10. We always have a feedback hour. You can call us on 0719 012 600. Then you can get to speak to Daktari directly and ask your questions. But in the meantime, say you're still in traffic and there's a lot of loud music and you're listening from your headphones, you could just tweet us.
Yes.
And then we're going to read the tweet to Daktari and then he's going to respond.
And Absolutely. On Facebook, people are tuned all over the Facebook, profile. Many people are tuned. Many people also asking their own questions. Juliet Cesaro asks, what's the cause of low sperm count and what's the solution for that? Anna Ann says, super informative conversation. Thank you, guys. And the big thank you is to you, Daktari, for coming through. And then there's a lady called Joy who says, I have a friend who goes even over a year with irregular menstrual periods. I think that's what you were talking about earlier. Mm-hmm. What could be the issue and advice on how to go about it. I think we're going to get into that section later on. Daktari.
Yes.
Wanaume tufanyaje?
Sasa wanaume.
Yes.
Kazi kwetu. Na ni kazi kubwa. One of the myths, let me start with the myth.
Yes.
One myth only is that is a myth that men cannot or men are not infertile. I think we should wrap that out of our minds completely. Men are infertile. And quite a number of the reasons of infertility in couples is actually men. The only thing, actually about 40% of infertility cases are actually directed to men.
40%?
About 40%.
Wow.
Now, the only thing that makes us think, see, we are all men here,
yes,
that we cannot be infertile is because we do not manifest the fruits of fertility. Whereby ladies, it will be seen. Si hata Biblia inasema by their fruits. The ladies will see a tummy growing, an abdomen growing as well. Okay, now this one is okay. But as men, there is nothing to judge us with. Sisi tunaacha mbegu zetu and that's about it. So that is why there is this myth that men can never be or men are not infertile. They are infertile. Now, when you come to some of the reasons why men are infertile, some of the causes of infertility in men, one of the reasons that I mentioned, remember we talked about blocked tubes in ladies? Yes. Men also have tubes. The tubes that actually bring sperm down to what we call the urethra, which actually brings the sperm out during ejaculation. Sometimes those tubes can be blocked. And they can be blocked, most of the time because of infection. Sexually transmitted diseases. Remember the one we talked about, yes, ladies? It can also affect men. So if they are blocked, you will find that, yes, men will have an ejaculation, but that ejaculation will not have anything. Then you'll ask, why is it so? Now, we have been created in a fantastic way. Sperm are developed elsewhere, are produced elsewhere. They are stored elsewhere. And during intercourse, what happens is when a man is having an orgasm, those sperms in a microsecond are actually transported from where they are stored. They pass through. They get mixed with what we call the prostate gland fluid. And then they come out as an ejaculate. So the other myth is that, if I ejaculate, then I shouldn't have a problem. You can ejaculate and still have a problem. You can actually ejaculate only what we call seminal fluid without sperm. Now, if the tubes are blocked, you'll find seminal fluid coming out, but there's no sperm.
Is seminal fluid what a lot of men get during wet dreams?
Sorry? No. Wet dreams is just a normal ejaculation.
All right.
Just a normal ejaculation.
Okay.
Yeah.
And sorry, sir. Is that what happens also when you get, when you're, what's the word for it?
Vasectomy.
Yes, vasectomy.
Yeah.
So it prevents the sperm from being fertilized?
No, it prevents the sperm from coming down. Okay. But you'll have an ejaculation all the same.
All right.
But the only thing that comes out is the seminal fluid.
All right.
So that is the other myth that me, I have intercourse and I have an orgasm and I have an ejaculation. So what is the problem? Seminal fluid or having an ejaculation is not equal to being fertile. Okay.
Right.
Now, the other thing is that the sperm may not be produced. How can this happen? You may have an issue with hormones. Remember, we talked about female hormones and male hormones. So if you have an excess of the female hormones, they will stop the production of sperm. But you'll still have an ejaculation. So when we have a patient, when one of the basic things that we do, we'll talk about this in a minute. When I see this gentleman, the only test, the first test I ask the gentleman to do is give a semen sample. So if in that semen sample there is no sperm, then the next thing that I advise them to do is to do a blood test to look at the hormone levels, several hormone levels. If the hormone levels are okay and still there is no sperm, then basically what it means is that sperm are being produced, they are being stored, they are not coming down. It means there is a blockage. So there is obstructive azoospermia. Now, if the hormone levels are high, it means there is no production of sperm. So it is unobstructive azoospermia. So lack of sperm is one of the reasons. We talked about blocked tubes. There is something which is called congenital absence of the vas deferens. Vas deferens is the tubes as well, which come down. Now, fortunately, this doesn't happen very often. It is limited in some societies, especially the Jewish society. Kwa sababu gani? They intermarry amongst themselves, and this is a genetic defect which is passed on from one generation to another. So if your father had that problem and he had, they got a child because of IVF, but that genetic defect will be passed on. So you'll have a son, yes, who is born, but will have the same defect like the father. So genetic, congenital absence of the vas deferens. Now, the tubes can also have a problem, can be blocked because of other reasons. It can be because of surgery. For instance, I had a case whereby a gentleman, when he was young, went and had surgery because what you call a hernia, where we have an opening in the abdomen, and some of the tissues can actually slip through. When the surgeon went to repair the hernia, he actually nipped and cut the tubes. So when he grew up, got married, 14 years trying to have a baby, nothing happened. He knew because they had done some semen analysis before and it wasn't working. So he was told, you know what, there is no sperm. Have you had any surgeries? Yes. What surgeries did you have? Hernia repair, both sides, what you call inguinal hernia. So most probable reason is because of the surgery where the tubes were cut.
94.4 Spice FM, we are the adults in the room where we're talking about understanding infertility in men and women with Dr. Kireki Omanwa, and we're together all the way till 10 o'clock. It's almost that time where our lines are open, but we just want to soak in the knowledge all the way till 10 o'clock. And guess what? It is 9 o'clock. If you go to that website, you can just, just take your phone, type that in your browser, and you'll be able to enjoy the conversation in full HD. It's about that time to open the phone calls, but we just want to soak in knowledge. But meanwhile, the phone call, the number is 0719-012-600.
We are discussing ways to better understand infertility in men and women, all of the myths, the causes and facts. And remember, all the lines are open on Twitter, Facebook, and Instagram to ask your question. If you're joining us, we have a very, very good doctor, Dr. Kireki, who is a gynecologist and a fertility expert, answering all of your questions about infertility. And Mike Okea says, hello, Spice FM. I'm getting you loud and clear from Maseno. My name is Kevin. Oh, Mike Okea is his handle, but Kevin Juma is his name. I have a problem of masturbation, and he's asking, can it render me infertile? Then secondly, he's asking, what strategy can I employ to stop it? He says, So one question there. The Menace says, quite an informative and spicy session today. I'm locked in from Bamburi. So keep your feedback coming. And also remember, as Emmanuel has said, 0719 600 is a number you want to call from around 9:15 going forward to ask Dr. your questions. Emmanuel.
Yes, Janet Munyeri says, very enlightening topic. Dennis Evans says, Malindi tuned. Like, people are just soaking in the information. So let's get back to it. We're talking about men.
Men.
Yes.
We are talking about men. We're talking about us.
Yes. We men.
So we talked about tubes. We talked about infection.
Yes.
And this infection can actually affect the testicles, can actually affect all the other components of the reproductive male system. There is something which we should always remember, especially if we have children, small boys, what we call undescended testicles. Normally, when the baby boy is in the mother's womb, before delivery, the testicles descend and they get into the scrotum, but not always. Sometimes this testicle, one of them can be inside the scrotum, another one can be in the canal, as it were. So ideally, for those ones of us who have boys, when you take this young man for assessment, one of the things that the pediatrician should do is to check. Even yourself, I mean, even the mother can actually check. Just gently check whether, the testicle is there. Now, unfortunately, if this is not discovered early and there are measures put in place to actually pull it down, or even surgically for that matter, you can grow and then you get married. You're trying to have a baby. It is not happening. You go and do a semen analysis. You find there is nothing. We check the hormone levels. We find everything is fine. So the next thing we do, go and do a scan and find out whether there is the testicles are in the right place. I've had several cases whereby gentlemen, have been infertile and they've tried to have a baby for several years. It hasn't happened. It's only after doing the scan, a scrotal scan, is when you find out that actually the scrotum is empty. So if the doctor who's doing the scan finds the scrotum is empty, the next thing is you have to start looking for this testicle. Where could it be? Could it be in the abdomen? Could it be in the canal? Where could it be? So if he doesn't find it, like a particular case whereby there were no testicles in the scrotum, they found one of them in the what we call inguinal canal, stuck somewhere in the middle, and they couldn't find the other one. So you have to do an MRI to actually try and locate where it is. And the next thing is basically you have to remove those testicles. Why? Because if you leave them there, they are actually going to cause cancer, testicular cancer.
Wow. And Doctor, is it painful? Like if it's...
You don't feel it.
Oh, you don't feel it?
You don't feel it. You see, the only thing that led to that is that we've been trying to get pregnant for 5 years. And it is not working. Mama yuko sawa, shida iko wapi? So
sasa daktari, huyu mwanamume hata akienda msalani anasikia empty scrotum zinashtuki.
Pengine hata ajui. Pengine hata ajui. You know. So that is undescended testicles. Gentlemen, as boys, when you're growing up, we like, these contact sports, football, karate and so on, rugby and so on and so forth. Sometimes you watch football on telly and you see a penalty or is it a goal kick, and the gentlemen are there with their hands in front of them. Yes. And then by chance that ball comes with such a high speed, and then it hits there, and you see the gentleman kneeling down slowly. You actually feel the pain for him. Yes. And that pain travels very slowly. Yes. Very slowly. Now, if you have such trauma once, twice, and so on, this is actually going to affect fertility later on. Because the body, with that trauma, the body starts sending what we call soldiers to around the testicle to protect it. But then as they're protecting it, it actually affects the production of sperm, unfortunately. So contact spots, the trauma that we actually get from some of these spots.
And how about diapers and nappies?
Diapers and nappies. Now, that is an interesting thing, because diapers and nappies is when they are young. But what I think is that those diapers are changed quite often. so they don't stay for so long.
Okay.
So that is not that may not be an issue.
All right.
Okay.
All right.
Now, we've talked about surgery. We talked about undescended testicles. We talk about diseases. There are so many other diseases that can actually affect the normal functioning of the male. Autoimmune diseases, for instance, where the body actually fights against itself and it sends soldiers. The immune system starts fighting other organs, and it affects, it affects fertility. Talk about high blood pressure. Some of the medications that we take for high blood pressure, some of the medications that we take for diabetes, actually can lead to low libido. Somebody asked about low libido. Yes. Can actually lead to low libido, and with low libido, there is a problem with function. Cancer is another big problem. I didn't mention cancer with the ladies, but unfortunately, it cuts across the board, as it were. In the ladies, we've started seeing in this part of the world, we have ladies who are having cancer, cervical cancer, which is the biggest problem. Sometimes even at 17 years, 19 years, and so on. Not to talk about ovarian cancer and so on and so forth. Most type of cancer, sometimes the cancers are actually in childhood. So the young lady or even the young man can undergo surgery, and they are treated with chemotherapy, and most chemotherapy will actually kill the cells, the gametes that actually produce sperms and so on. So that is another problem. Radiation. After treatment of cancer, after surgery, sometimes patients actually need radiation. Radiation therapy will actually kill the cells that are responsible for fertility. We talked about lifestyle. Lifestyle affects the ladies, and also affects the men. As you asked about the question about drinking, if you can drink a crate of beer, yes, you can drink a crate of beer, but then you will not be functional at the end of the day. Utaamka tu na hangover, unashindwa kwani this lady is lying here and what did I do? Hata ujui ulifanya nini. So that can be a problem. Now, excuse me. The other things that causes infertility, which is again in this part of the world, especially in Kenya. I don't know whether we remember some time ago, some ladies, I think it was from Nyeri or somewhere, where they said these men of ours are not doing what they're supposed to do. Wanalala tu afanyi kazi yao. Alafu wanaenda wanalewa. So what they were doing is doing what? Wanangoa transformer. Walikuwa wanakata. So if I'm not using it, let nobody else do what? Use it. So obviously that leads to infertility straight away. Now, sometimes the connections of the tubes, where the sperm is supposed to come out, remember it comes out in the same tube where urine comes out. There can be a misalignment or disconnections there. And what happens is that sometimes instead of the sperm coming out, it actually goes back. It goes back into the bladder. So sperm, you'll have intercourse. There will be an orgasm, but there will be no sperm. The sperm will go back into the bladder and into the urine. There are gentlemen who sometimes, because of neurological issues, cannot actually have an orgasm at all. The other thing which may sound prosaic is work. There's a time we went to Coast and we had a clinic there. We saw about 700 couples. One of the factors that kept on reappearing, I think it was about 30% of the patients that we saw, is that I am living here, but my husband is elsewhere. My husband works in the Middle East, in Europe, in America, and so on. And my husband comes back only for 30 days. Or comes back for only 2 weeks. So in that 2 weeks or 30 days, if he comes when you are off the cycle, it doesn't matter how much you have intercourse, you will not actually get pregnant. So these are some of the things which actually are the reasons of infertility in male and in females as well.
Dr. You've said, and you've just reminded me of to mention the work point.
Yes.
The work factor, rather.
Yeah.
More than it has to be more than twice a week for better chances.
2 to 3 times. That is on
twice,
average.
three times a month. You can't score.
If if you get to that fertility window, we call it a fertility window, your wife is ovulating and everything is okay, and you actually get into that window, of course, you can do it once and she gets pregnant. Yeah. Just like what happens with our young people. I lived in Poland, that is where I trained. And one day I had a very interesting case. There was a young lady who was 14. And they brought her to me, and they started telling me the story is that she started having symptoms of pregnancy, but because she was 14, nobody ever thought that she could be pregnant. They took her to hospital. They did all manner of tests, endoscopy, putting a pipe in the mouth because she was puking and she was doing this and so on, and they just couldn't find out any disease. And then one of the guys said, you know what, why don't we do a scan? So they did an abdominal scan, and there was a beautiful baby which was around 16 weeks, playing around. They say his young girl is pregnant. So basically what she's having is the normal pregnancy symptoms. So they sent her to me. She came to me, and while I was taking the story, I asked her, but did you ever have a discussion about sexual matters and so on and so forth? And were you told that you can get pregnant? She said, actually, we never had this discussion. The only information she had got was from her colleagues, her friends. Obviously, what do they know at 14 years, 15 years? Yes. And one of the things they told her is that if you have intercourse, ukisimama, huwezi kupata mimba. So one day, she actually did it. A quickie. Actually, by the stairs, a quickie one while standing. Si aliambiwa haitashika, and she got pregnant.
Jamaa alijituma
Lazi kurudi.
That is interesting. So and Daktari, and
yes.
How about things like there's some things like Viagra.
Yes.
Like you take it in order to help you
absolutely
help it work. Do you think if you take it too much, it can affect your fertility?
Actually,
in the long term?
It's very good that you brought up that question. When I heard about Viagra, and I have some patients, taking it, I came to learn of a phenomenon which is again in this part of the world. Not only, but I think principally this is where we live. They call them what? Ben 10s, or what are they called? Ben 10s. The young guys who are, taken over by,
older women,
mature women, and so on.
Daktari, this story is so juicy. I just want you to finish it. Pole. Exactly once, and then I interrupt you. I just want you to finish it, Paul. So we'll start from there. We'll start from the Viagra story. This is Spice FM. I'm in studio with, Eric. Barbara is not around, but we have a special guest in the building, Dr. Kireki Omanwa, and he's an IVF specialist. We're discussing, we're understanding infertility in men and women, and the conversation is... I'm learning so much. We're going to come back and continue from where Daktari left. But meanwhile, some Whitney Houston. Eric, I always hear you talking. Many people don't hear this. You talk about having conversations that, they're going to uplift someone.
Yes.
And I feel like this is one of them, my brother.
Yes. The idea is to be impactful.
Yes.
And not just be full of yourself. And every day, if you can have a conversation that can change somebody or lift them up and make them better, then you are actually providing a service to the community.
Yes, man. And remember, the hashtag is AdultKE. You can use that to reach out and just share with us what you think. Today, we're talking about understanding infertility in men and women. Barbara is not around for those of you who have just joined us, but we have another special guest, man. And Barbara, I'm sure she's listening, Dr. Kireki Omanwa. And, he's just dropping gems. He's just dropping gems on a continuous manner.
Yeah, na tunanyonya hapa information. Tunanyonya tu information.
Nyonya tu.
Dr. Omanwa, there's a lady, not to digress so much for a quick second. Yeah. There's a lady poet I love and revere, but she's since passed on. Her name is Dr. Maya Angelou. I'm sure you are conversant with Maya Angelou. And Dr. Maya Angelou used to say that when you get, give. And when you learn, teach. So you are doing just that. And I applaud you for that.
Let me tell you, man. Eric, why am I slow, man? Why am I slow, man? I echo those sentiments from the bottom of my heart. Eric, I think we can just go straight back into the conversation.
Let's go right straight to the conversation.
I'd asked you, because we're talking about some of the challenges in regard to men. And one of the things I asked, because there was a day I was in this, it was during this post-election violence period.
Yes.
So there was a lot of not going to work. Guys were just hanging around in their estates.
Yeah.
And those days we used to stay in Madaraka estate. And there was my friend owns a chemist. So this guy walked in, a pumped guy, very big, asked for some tablets, which my friend told me, sexual enhancing tablets, and some drink. So akakunywa drink na akakunywa tablet, and he majestically walked away
out.
And we were mysteriously wondering where he's headed. So I was wondering, if you do that repeatedly, will it affect you? And there's a story you're telling us.
Now, let's come back to that friend of yours. You said he was pumped up.
Yes.
He was big.
Yes.
So he must have been doing a lot of weightlifting and so on.
Yes, probably.
And then apart from that, you see, it's not possible for us to have so much muscle. You see these guys who have big muscles which look like thighs and swollen, and then they have tiny bottoms and so on, big thighs and so on. Now, what unfortunately they do, in as much as they go to the gym and do this lifting, they also take hormones, testosterone, and the testosterone actually builds the mass of muscle. So that is why you see a guy who's swollen kabisa is full of muscle, but then unfortunately, when they take testosterone, here it is big outside here, but down there, ni kadogo. Unfortunately, it works the other way. Normally, people who use testosterone, in as much as it may increase the libido of a short period of time, if you use it over a long period of time, it works negatively in that when that level is high in the system, it goes and shuts the place where actually the place which stimulates or produces testosterone in the brain, which tells the testicles to start producing testosterone. So what happens is that testosterone is high. This informs the brain, say, please don't stimulate, don't tell the testicles to produce testosterone, funga hiyo njia. So when that avenue is closed, the testicles don't produce sperm. Alafu unakuta hata libido inateremka. Sawa sawa. Now, that is why you saw that guy. He's big here. Kule chini ni kidogo. Yes. So functionally, he's actually not doing what he's supposed to do. Ndio maana alienda, your friend gave him some tablets, blue tablets as they call them, and he took it with a drink, whatever that drink was, and he marched majestically out to go and do what he was supposed to do.
Yes.
Now, there is a problem with that. The blue tablets, actually, when they were produced, they were supposed to help mature men. Because as we grow older, what happens is that our system starts slowly, slowing down, as it were. When we are younger, you can go, when a man is urinating, you look at a small boy, akiamka asubuhi, you can actually shoot the urine there. When you are 60, urine will be dripping around your foot. It's just because this is physiology. Tunazeeka, the system actually starts, slowing down, as it were. Now, the blue tablets actually help the men who have an issue with libido. Libido iko chini. It stimulates the flow of blood into the penis, and the blood has to be there, because in order to have an erection, basically what happens is blood flow, a huge amount of blood flow into the penis, and that's what causes an erection. So the blue tablets actually sort of open the vessels, and blood flows into there, and then you can actually have intercourse. Now, we started talking about young men who actually use these blue tablets. Most of the time they don't need it, but because they are in relationships which don't make sense, these older ladies want to be serviced, in quotes. So they'll pay for your airfare from Nairobi to go to whether it's White Sands in Kwale, whatever it is, and the whole weekend is taken care of. You have one responsibility, one obligation, to actually service this lady. Physiologically, you may have maybe 2 shots, maybe 3 shots if you really, really, are up to it. But this person needs more. So what do? Si unajisort, unabeba to blue tablets. So when it comes time for extra mileage, as it were, you pop one. you go, another few shots, as it were. After some time, there is tolerance. So your body tolerates that one tablet. So after taking that tablet, you are not as active as you used to be. So what do? You take 2. So with 2, you still are active, but after some time, become tolerant, you start taking 3 or so. And then it reaches a place whereby these tablets stop working for you. One of the senior urologists in this town actually told me he has clients, young men, who are 25, who are 26, with erectile dysfunction.
Yeah.
They can't have a normal intercourse with their girlfriends or whatever it is because they are not up to it. Their body has actually overused. They have overused these tablets. Its physiology is no longer functioning. So they have a problem at 25, 26. A huge problem.
Dr. You've mentioned something very interesting. I don't want you to pass me.
Yes.
Physiologically, you have 1 or 2 shots, did you say?
Yeah.
There's a lot of pressure from women. I will admit, as a not so young man,
yes,
there's a lot of pressure from women. So an average woman who I would date requires that I pound her like I am maybe 4 times a night for 4 nights.
Yeah.
So we pound each other like I am on Friday. We pound each other like I am on Saturday. We pound each other on Sunday and Monday kabla ende kazi. So I just wanted you to talk for a quick minute or longer as you so wish. How long should a session of sex last? And is it normal medically that a man like Emmanuel here should be required to perform 6 sessions per night for 4 nights?
I think it should not be how many stations or how often we are going to pump. It is the quality. Does she get satisfied? That is a big problem. By the way, about 85% of women have never had an orgasm in life. 85%. Sasa, you can pound 20 times if you want, but if she doesn't get satisfied, she will still want to be pounded. But if she gets satisfied, hata kama ni moja, but it is done well, it's okay.
Ataachana na wewe.
And you'll also be happy that actually your partner is also satisfied. And I think that is where we miss the point. It is not how many times I can actually do it, but are we satisfied? Men, men were different. Men were visual.
Yes.
Unaona somebody you think looks nice and so on, and you feel you're sexually attracted, you can have an orgasm just like that. For women, it's different. Women is like baking a cake. Unachanganya unga, unaongeza vitu vingine, you put it in the oven, you control the temperature, unaangalia, and so on. So women take longer. That is why some experts say that if you really want to have good sex, inaanza asubuhi. Mnaongea vizuri, katext hapa, sijui nini, ukija jioni, maybe with something, there's the caressing and so on. So she starts getting prepared psychologically. And as men, ni dakika moja tu, bunduki imesimama ile
imara kama kuna huyu jamaa hapa Emmanuel anaitwa Shua Graham. He says, Doctor, is it scientifically true that the speed at which the sperm swim inside the woman's uterus then to the fallopian tubes determines whether or not fertilization can occur? If so, how can this speed or gradient be increased, and what causes this speed flop?
Now, that is now the parameters of the sperm. We can talk about that in a... Now, when we ask a gentleman to go and give us a semen sample, there are several things we look at in that ejaculate, as it were. The time it was given. There's a time we leave it to settle, as it were. And then now we start analyzing it. We look at how much of that ejaculate is in the container. Ejaculate should be at least 1.5 milliliters. Now, we look at the pH. The pH tells us whether this ejaculate is acidic or whether it is, alkaline and so on. The pH should be more than 7.2. So if it is 7.0, it means it's acidic and it's not a good thing. Now, we look at how many sperms are in 1 milliliter, what we call concentration. There should be at least 15 million in 1 milliliter. So if you have 30 million, for instance, in 1 milliliter, and then the ejaculate is, let's say, 2 milliliters, so the total number of sperm will be 60 million. We need it to be 40 million or above. Now, we're talking about the speed, the way these sperms swim. There are different types of actually motility. We call it motility. Let me just use this as an illustration. They are the ones which swim very fast, what we call type A. Let's call them the sprinters. So the Jamaicans, Americans, and so on.
Yes.
Those are the sprinters. Type A.
Usain Bolt.
Alafu, there's type B, which swim as fast, not as fast as the sprinters, but they are also progressive. So let's call these the Kenyans. These are the long distance runners. And then there's type C, which swim but in one place. They don't have direction. Zinazunguka too, but they are not making any progress. Now, when it comes to assessment, we actually assess type A, the sprinters, and type B, the long distance runners. These ones should be at least 40% or more. Now, we go further down, we look at what is called agglutination. Agglutination is where sperms can actually stick with each other. Not a good thing. They can stick with each other head to head. A sperm has a head, which basically is the most important part of the sperm. It has a neck piece, and then it has a tail. Now, we look at whether there is agglutination, and if it is there, what type and the severity. Ideally, it should not be there. We look at white blood cells. White blood cells should be less than or equal to 1 million per milliliter. If there are more of those white blood cells, it means there's an infection somewhere. We look at whether they are red blood cells. Red blood cells are not supposed to be there because blood is not supposed to be in a semen, in an ejaculate. Out of those, let's say 60 million or 100 million sperm that we have, we also look at what is called morphology. How many of them are normal? Normal in the sense that it has a nice head, it has a neck piece, and a normal tail. It's supposed to be 4% and above. So out of them, 100 million, let's say, and if we say that 10% are normal, then actually it's a very good sample. Now, talking about how many of them, how many need to swim and how far they need to swim and so on and so forth in order to fertilize that egg, that is why all these parameters are important. The more they are, the more the normal forms, the better the motility, the higher the chances of actually impregnating or getting pregnant. And then the lower they are and so on and so forth, again, the lower the chances. So you'll get a result which says normosospermia, meaning the sperm sample is normal. You may get a result which says oligosospermia, meaning the numbers are low. You may get one called hypospermia, meaning the ejaculate is low. You may get one which says asthenosospermia, meaning the motility, the way they are swimming, is not good. Or you may get one which has a long name called oligoasthenoteratosospermia.
All right.
Meaning the numbers are low, motility is low, and the normal forms are also not there.
The longer name means uko na shida.
Uko na shida. Inaitwa oats, lakini sio zile oats tunakulaga asubuhi.
Daktari, just very quickly in a layman's language. I am a man. I love women because women are not as drab as us. And we were sharing during the break that men, while we have a challenge because of our upbringing, we are required to be very stoic. I have my penis and my scrotum. What can I do to take care of myself so that in the place of being ready and become a husband, I can better perform the duties of siring a child? Are there the ABCs of taking care of my manhood?
Your manhood, yes, definitely, they are. Number one, they're actually simple things that generally all of us can be able to do. Number one, eating well is important.
And what does that mean?
Eating well. Eating well means eating a balanced diet. There are some foods which actually enhance the quality of the sperm that we have. For instance, malenge, pumpkin seeds.
Emmanuel Malenge. Malenge.
Pumpkin seeds. Pumpkin seeds are very good for sperm. Why? Because they have a lot of zinc. They have a lot of what we call selenium. Zinc is very important for motility of the sperm.
Is this the one that sometimes is dried? Because I normally go to a place up on Gong Road and I buy the dried pumpkin seed and put it on my oats. Yeah, the seeds. So I'm doing a good job.
You're doing a good thing.
Seeds. Yes, I buy the seeds, put them on oats, and with almonds, alafu nakula.
Oh, yeah. That's good. That's
you can actually grind them.
But you're doing it for future, I'm sure. Unajua Jama is a celibate man. So I think he's really taking care of himself.
I want to be ready.
So malenge, pumpkin seeds, flax seeds. Flax seeds are tiny, brownish, slippery. Ni kama sim, but they're not really.
Chia seeds?
Chia, some people say yes, it works, but more in women. There's red chia and the black chia. Right. But men, what in my experience, what I have seen, the pumpkin seeds and the flax seeds. Flax seeds have some oil, which actually helps in the motility of sperm as well.
Is it same for groundnuts?
Sorry? The same for groundnuts. Groundnut is basically proteins. Yeah. And sperm needs a lot of, the whole body needs proteins, but groundnuts and other nuts as well, Brazilian nuts as well, also have some oil there, which is very important. But specifically what I have noticed, flax seeds, or pumpkin seeds, if you throw in the groundnuts and you throw in some cashew nuts and so on, actually they go a long way. Now, we have what we call antioxidants. Very, very important. The antioxidants, vitamin C, vitamin E, for instance, they are very, very important because they protect what we call the head of the sperm, the lining of the head of the sperm. Because sometimes when the sperm pass through the tubes, they can undergo what is called oxidative stress because of going through there. Now, these antioxidants actually help that to sort of protect the sperm from against this oxidative stress. Now, we talked about exercise. Exercise is very important. It doesn't mean that you have to go to the gym or you have to go somewhere and do 10 kilometers or whatever it is. It is the regularity of doing that exercise. Whether it's swimming for half an hour, twice a week, whether it is walking, and so on and so forth. Why is exercise important? Because as we exercise, we actually breathe out what the bad things, and we take in more oxygen. But as we are doing that, circulation is enhanced. This circulation, fresh blood, a lot of oxygenated blood goes into the brain. The brain starts releasing what we call endorphins, and these endorphins are actually that feel-good hormones, and this actually later on can actually translate in the bedroom, and so on and so forth.
So it's actually not far-fetched when my gym mates tell me that now utakuwa imara kabisa.
Hapo. Na ukiongeza zile malenge unagurumia.
Daktari yuko na nguvu mingi sana. Unajua namkaga usiku nasema hii nguvu jamani.
Unaweza ukasambaza hiyo nguvu kidogo.
Eric, I'm just looking at that clock and I feel like just telling it to stand still because it's just running. Daktari, I want us to get into some solutions.
Yes.
Because I feel like maybe if you're unable to get children, maybe you adopt. Maybe you decide to live childless.
Yes.
And become a philanthropist or something.
Yes.
Or just adopt, as I said earlier, or IVF.
Yes.
So do you want to break down some of the solutions as we go along?
Yes. Now, first of all, before we go through the solution or to the solutions, we need to find out the reason. So for the ladies, we normally do a few tests, more tests than men. Ladies are a little bit more complicated than we are when it comes to that. So the first thing normally, what I do for a lady, I want to find out whether the tubes are okay. Because if the tubes are blocked, it doesn't matter how many times you are going to have intercourse. It doesn't matter whether your husband's sperm, partner's sperm is okay. It's going to be almost impossible to get pregnant. So we want to test the tubes. We want to look at the hormone levels. Specifically, we want to look at a hormone called AMH to see whether what we call the ovarian reserve is okay. If the ovarian reserve is high, the chances of getting pregnant are also high. If it is low, the chances of getting pregnant are drastically reduced. We want to see whether another hormone called thyroid stimulating hormone is okay. This is like a manager of other hormones in the body. If it's elevated or if it is low, it's going to affect fertility. There's another hormone which is very important, which actually tells the breast to produce milk. It is actually very high when a lady is pregnant. Why? Because, God created us in a fantastic way. Immediately a woman gets pregnant, messages are sent all over. And to the brain, there's a center called the pituitary gland. Inaanza kuambia matiti, anza kutayarisha. There is somebody who's going to consume this milk. Now, that hormone is usually quite high when a lady is pregnant, simply because once a lady delivers, there is a consumer, so that production of milk has to be there. Now, sometimes because of different reasons, it can be stress, it can be some pathology and so on, a lady who is not pregnant can have an elevated prolactin. If it is elevated, what it basically means, it tells the body, tells itself that actually with a high prolactin level, you are pregnant, so you don't need to get pregnant again. So it shuts off other possibilities of getting pregnant. So we need to find out. Sometimes you find because of an elevation of this hormone, you treat it, everything is fine, she gets pregnant without any problem. So diagnosis. Number 2, we want to do a scan, to look at the ovaries, to look at what is called antral follicles, and to look at the womb itself. Because sometimes if there is a problem with the lining, you remember we talked about this studio being the lining of the womb. If there's something growing there, it's going to be a hindrance in getting pregnant. So we finish with the ladies. To the men, it's something very simple. Give a sample. And unfortunately, that sample, 99% of the times, has to be done through masturbation. It's only once. Men have an issue with this, or most men have an issue with this, but from that ejaculate, we'll get a lot of information. We'll get information about the volume, about the number of sperms, about how they swim, about how many of them are normal, and so on and so forth. Now, if there's an issue with that, with sperms, whether it is, let's say, the numbers are few, or whether the motility is not there, then we can actually use some medications. There are medications we use, antioxidants, and so on. We can throw in the pumpkin seeds and other things which can actually enhance this. Normally, we suggest that they take these medications for 3 months. Why? Because on average, the body takes about 2.5 to 3 months to produce a fresh sample of sperm. So they take medications, they come back, we repeat the semen analysis. Now, we have done this and we have found, for instance, that the tube here is fine, or the tubes are fine, but the sperms is an issue. So we correct the sperm, and then we repeat the sperm analysis, and then we take it from there. Sometimes we find that everything is fine, and they are not getting pregnant. So we actually can give some medications to the lady to enhance the production of eggs. Instead of producing 1, she may be able to produce 2 or even more. And then we do what is called follicular tracking. They come for a scan. We do a scan. We find out whether they are follicles. A follicle is what carries an egg, and how big that is. And then we can actually induce ovulation such that we know from this time to this time you have a window where you are going to ovulate. Sasa, most of the time you find if the sperm is okay, the tubes are okay, wanamwambia dada, waambie mzee kesho atahitajika. Aambie boss asimpatie kazi nyingi sana. Atakuwa na kazi nyumbani. Sawa. What you call timed sexual intercourse. Because we know we have an ovulation window, and they are going actually to have that. Usually it helps in simple problems where there are no big issues. Actually, it's quite successful. If it doesn't work, then we have what is called IUI, or intrauterine insemination, where we prepare the lady, the gentleman gives us sperm, we clean it, and then we inject it directly into the womb.
Yeah, you're going to tell us more about that, Dr. When we come back, 94.4 Spice FM, we are the adults in the room. What are we talking about, my brother?
We are understanding infertility in men and women with Dr. himself, Dr. Kireki.
I'm telling you, my brother, when we come back, we're going to get back straight from where he left. Some people coming up right now. Yes, Eric?
And absolutely. Angeline hung on the line, and Max, they have pressing questions. They've begged that we ask before we sign out. So we'll ask Angeline, don't worry.
I don't know what's wrong with that clock, Bran.
Time is flying. Dr. You have to come again. We have to look for another time Doc can come again.
Moby Croc Ray spoiled Ray moving too fast Ray. Moby. Let's just get back into it. That was some M people. I'm sure it has taken you way back, but let's just quickly go back into the conversation. Dr. Terry, there were some things you were taking us.
Yes, we had actually started talking about some of the solutions.
Yes.
And we had reached a place where we do what is called IUI, where the husband gives us a semen sample, we clean it, and we inject it into the womb. Now, that is another solution. There is another solution called IVF. Now, IVF was basically came about where to help couples who had issues, especially with blocked tubes. So what happens in IVF is that we take this patient, the lady, during her period. When she starts her periods, we do some blood tests, we do a scan, and if everything is okay, we start injecting her every day with medication. We monitor how she is responding to these medications by doing scans. What we aim to do with these injections, normally a lady produces one egg, but in IVF, we want her to produce as many eggs as possible. So the younger they are, the more eggs they produce. So if we get, let's say, 20 eggs, that is okay. So once she's ready, we take her to theater. We get the eggs out. We don't do any cut anywhere. We actually get the eggs transvaginally through the vagina. We use a long needle, which we do what is called aspiration. We get the eggs out. We have a special scientist, somebody who is educated and learned in creating embryos in the lab. So he or she will take the partner's sperm and inject the sperm into the egg, because normally this is what happens in the tubes. Once that has happened, we put these embryos or these fertilized eggs in an incubator, and they start growing.
All right.
So we monitor them, and when it's, let's say, 3 days after fertilization, we go and have a look. Let's say out of the 20 eggs, we have, let's say, 15 embryos. Obviously, we can't transfer all 15 embryos into the womb. We normally take anywhere between 1 and 3 embryos. We transfer that, and then the rest, we can actually freeze them. We freeze them in liquid nitrogen at minus 196 degrees Celsius. So if you put your finger in that liquid nitrogen, actually it will burn.
Wow.
So we freeze them there, and we can actually freeze them for even up to 5 years. There have been cases whereby children have been born out of frozen embryos, which have been frozen for 20 years. But that was in the UK. Now, that is one of the solutions. That is one of the solutions, especially when you have blocked tubes, when you have low sperm count, when you have no sperm at all. We can actually use these solutions. Now, somebody asked about, if I can answer that question very quickly, about a boy.
Yes, there's a gentleman here, Max. Yes. He's asked, Salamia Daktari, please ask, can our guest touch on sex selection, how to get a child of specific sex?
Sex. Now, there are two ways. One of them is just trial and error, where it says if you want a child of a certain sex, you have intercourse at a certain period, either right at the beginning of ovulation or past ovulation. It doesn't work at all. So there are some who have done it and it has worked, and some who have done it, and many of them have done it and it hasn't worked. We don't have any articles, because in order for me to endorse that method, we'd have to take, let's say, 200 couples. We divide them into 2 groups, and we tell them, you guys have intercourse at this time, you guys have intercourse at another time, and then we see how many of them will get pregnant and how many of them will have which baby. And then we can say, if you are going to have this issue, you can use this method, and this is what is going to happen. So that one is trial and error. The other one, you remember we have talked about IVF. So we take the lady through IVF. Those 15 embryos that we got on day 3, we do what is called a biopsy.
Yes.
We remove some cells. By the way, these embryos have about 10 cells. So we remove about 3 cells, 3 very tiny things. And then we send them for analysis. And we get the results back after about 10 days or 2 weeks, that embryo number 1, embryo number 5, embryo number 7, embryo number 10, these are XY. And they are viable for transfer. embryo number 2, number 3, number 4, number 7, these are XX and viable, meaning they are okay for transfer.
Yes.
The other embryos, they are XY and XX, but they have problems. They have what is called aneuploidy, or they have what is called trisomies, and so on. So these ones cannot be transferred. Now, once we know that embryo number 1, number 3, number 7, number 10, these are XY, meaning these are the ones which are going to be boys or are boys. So if you want that gender, so we'll only transfer those XY. If you want a baby girl, then we'll use that embryo number 2, number 4, number 6, and whatever, which are XX. And we have actually tested it. So somebody may ask, what is the success rate or failure rate? It's 99.9%.
That's fantastic.
Yes, that if we have tested and we got a result that this is XY, it's going to be XY.
Dr. Ari, I'm glad, and you'll tell us just before we wrap up where people can find you, because I'm sure tons of them want to.
Yes.
Angelina asked, talk to us, Dr. Ari, about acidity. What causes acidity, and what can be done to reduce acidity in women so that fertility can take place? And she says, please address this.
Acidity in women is what is needed in the vagina. The vagina has to be acidic. Why? Because in the vagina there are a lot of bacteria, different bacteria. In order for the lady not to have infections, a wide spectrum of infections, the pH in the vagina is acidic. And this is actually produced by a specific bacteria called lactobacilli. And it creates that acidic atmosphere. Now, if there is a change in that acidity, what happens is that there is a propensity of having infections. So you'll have yeast infection, you'll have other bacterial infections, and so on and so forth. So for women in the vagina has to be acidic. Different for men. For men, the semen has to be alkaline. Now, God has created us in a fantastic way, in that when you have intercourse, the vagina is acidic, the semen sample is alkaline. When they meet, actually the pH is neutral.
Oh, amazing stuff.
It's neutral.
That's amazing.
It's amazing.
God is an artist.
Is better than an artist.
Yeah.
He's better than an artist. So for that lady who talks about acidity, I don't know whether she's talking about acidity specifically in the vagina. That is the way it is supposed to be.
Doc, there's Eva who says these doctors should come back for a whole week. Emmanuel,
I'm even wondering if we should extend this show.
We stop the time. We stop the time.
This clock. Maybe this clock is spoiled. Inaenda sana.
Dr. Somebody wants to find you. Where do they find you? Are you on social media? Do you mind sharing your number online here?
Yes, I'm on social media. I'm on Facebook. I have my Facebook account there. I have actually a support group called Kenya Fertility Support Group.
Wonderful.
We talked about what men can do.
Yes.
Actually, on the Kenya Fertility Support Group, every so often, I want to make it a regular basis to actually be answering questions. So usually on Sunday evenings for about an hour or so, I sit on my that Kenya Fertility Support Group, and the members throw in questions and I answer them.
That's on Facebook?
On Facebook, okay. Yes, Kenya Fertility Support Group. So usually on Sundays, I usually put up a notice. Today from 8 o'clock, I'll be answering questions.
Wonderful.
I mean, it is a way of actually spreading this information.
And how about reaching out? If I can't wait for Sunday, I just want to reach out tomorrow.
Tomorrow, then I'm located, basically my office is on Gong Road. The building is called 5th Avenue Offices. People always ask, and what is the building? The building is 5th Avenue Offices. On the third floor.
Near Bishop Court, I know it.
Yes, on the third floor, room 314.
All right.
And if somebody wants to get in touch with me, you can actually call the office. And the office number is 0780. Very easy to remember. 0780 170 170.
All right. That's a very easy number.
Very easy number to remember. And I'm usually in the office on Tuesdays and Wednesdays from around 2 o'clock. until around 6, 7 o'clock.
All right. Yeah, we know that some people say sinataka daktari mwenyewe. Sitaki kuongea na assistant. But thank you so much, Daktari.
Karibu sana.
This has been one of those shows. I was just looking at that clock and I just feel like grabbing it and throwing it away. But man, I wish we could just go on and on. Eric, you wanna thank our
Daktari, thank you for spreading the love. I really respect that you've garnered this knowledge for a long period of time, and there you are coming here sharing very generously.
Yes.
So keep on keeping on. We pray that we meet at the very top and that we have less cases of infertility. Because when we know better, we surely do better.
My prayer is that you remember when people started, AIDS cases,
Yes.
HIV cases,
Yes.
people were hiding, they didn't want to
Yes.
talk about it, and
Yes.
so on and so forth.
Yes.
Until some prominent people came out and said, you know what, my child died of, this, I've had relatives of this, and so on. So my prayer is that one day, this will just be the normal thing.
conversation.
Absolutely.
94.4 Spice FM. There you have it. This show, I think it's going to be on YouTube by tomorrow, Mombi. I'm
Absolutely.
sure you can check it out. Tomorrow, what's happening at 6 a.m., brother?
CT Muga, Eric Latif, and Duo Koa here bright and early, 6 to 10 a.m. on the Situation Room. So you want to catch up to that other big party.
On at 3 p.m., Spice Drive will be on from 3 all the way to 7 o'clock. And at 7, we'll be back. Same show, same place, same people. On behalf of Mombi and Brian Amlioto, we just want to wish you a very, very good night. It's 10 o'clock.